Good morning to all of you. Welcome to the program agenda. I'm your host, Cito Beltran, welcoming you on this Monday, the 26th of September, and very thankful that for the most part, what was supposed to be disaster did not turn out as predicted or feared by many. Yes, we got hit. We got hit by Typhoon Karding, but from the looks of it so far, the damage is not as disastrous as we had expected. So thank God for that. Welcome to the program. Thank you for being subscribers of Cignal TV and viewers of One News. We are One News, all sides, all the time. Now for the daily starter, let's get on with the program. Faith is not hoping God can. It is knowing He will. Please start your week with that thought that faith is not about hoping, sana Lord, I hope God, but that God can. Okay, so put that He will, that God, it is knowing He will. Okay, let's now go to the front page of the Philippine Star. We've got a busy day today. And I do hope that many of you don't have too much of a mess to clean up and that no one was hurt. But the news is a bit delayed because I think this is still picking up from yesterday. The front page of the Philippine Star, Metro Manila, Luzon, brace for super typhoon. By this time, we are now bracing for finding out how vast the damage was, particularly in agriculture. Many places were flooded, but the early preparation for Typhoon Karding admittedly has lessened the damage, and the biggest concern is the rice harvest now and in the coming months, because we were supposed to be scheduling for the rice harvest beginning this October. And we just prayed that that typhoon didn't destroy as much as expected. Meanwhile, the United Nations has declared drug control and human rights can be compatible and should be compatible during the conference of the Commission on Narcotic Drugs. Okay. So, and that big photo at the top of the front page of the Philippine Star, our personnel of Quezon City Disaster Risk Reduction and Management Office preparing rescue boats for the typhoon, which is expected to pass or has passed the mainland or the territory of the Philippines by today. Meanwhile, free calls, internet from Globe PLDT Smart. Telco giants PLDT Inc. and Globe Telecom Inc. yesterday said they are ready to deploy free call and internet services to areas that will take a direct hit from Super Typhoon. PLDT and Smart have likewise activated quick response teams and deployed generator sets in Tuguegarao and in Gataran in Cagayan. Currently, there are no reported signal disruptions and power interruptions. That was as of yesterday. And a photo in the center of the Philippine Star, President Marcos delivers a speech upon his arrival at the Ninoy Aquino International Airport Terminal 2 yesterday after attending the 77th United Nations General Assembly in New York, and he declared that his U.S. visit was successful and a number of American companies have committed to expand their investment footprint in the Philippines, President Marcos announced. Okay. And DepEd sets new class suspension policy in Department Order number 37, where much of the decision will rely mainly on the local government unit and the declarations of pag-asa in areas where there is typhoon signal 1 to 5. There will be suspensions, and that would also, of course, be dependent also on the local government unit affected. The Philippines does not need money from POGOs. According to Senator Sherwin Gatchalian, the country does not need the trickling revenues from Philippine offshore gaming operators, which are not only unstable foreign investments, but also act as magnets for criminality. Anyone who calls POGOs foreign investments need to have their head examined. Okay, vaccine drive in typhoon area suspended. And the declaration was from the DOH saying all vaccination activities in the National Capital Region and the rest of Luzon are suspended due to inclement weather. Last but not the least, photo at the bottom of the Philippine Star shows a photo of Pasig City Mayor Vico Soto and Representative Roman Romulo during the 3-day Professional Chess Association of the Philippines Chess Festival hosted by Estancia Mall here in Pasig City. Okay, that's our run through of the Philippine Star. Next up, we have Pam Vasquez, mobile journalist, reporting from Marikina. Good morning, Pam.
Good morning, Sir Cito. Ayan, we're here at malapit po dito sa Marikina River Park.
Okay, and what is the situation there? Earlier, you showed us a video that the area is still flooded. If there we go, that is that area at the foreground is actually a street. Hindi ba kalsada yan in front of the I Love Marikina sign?
Yes, Sir Cito. And if pakita ko lang din po, Sir Cito, hindi lang po siya ma-zoom, pero currently, parang below 17 meters na po yung water level dito sa Marikina River. Mm-hmm. Medyo baha pa din, Sir Cito, pero mas mababa na to compared kagabi. Kasi kagabi, Sir Cito, until doon po, medyo tumaas yung baha.
Okay.
And then kahapon, ngayon din medyo nakiklear na yung road sa taas. Kasi Sir Cito, kagabi, puro nakapark na mga sasakyan dyan, 2 lanes. Pero simula kaninang umaga, may lumapit na mga traffic enforcer para ihawi yung mga sasakyan. Kaya ngayon, passable na yan, Sir Cito.
Okay. Now, Pam, I don't know if you remember, but the arrival of Karding is coincidental to the dates that Typhoon Ondoy hit Metro Manila, and Marikina River and Marikina Valley was one of the most seriously affected. Sa nakita mo, how much damage initially has Karding caused? Is it similar to Ondoy or hindi naman?
Well, Sir Cito, so far, yung nga ang sinasabi nila, hindi naman daw ganoon ka-disastrous compared nga doon sa Ondoy, which hit same day 2009. Pero dahil nga din doon sa takot nila, Sir Cito, from the Ondoy, kagabi pa lang, kahit hindi pa nag-first alarm, madami mga families na din yung preemptive evacuation sa mga schools or gymnasiums. Yun nga, from 20 plus evacuations before, Sir Cito, itinaas or nagdagdag sina Marikina Mayor Marcy Teodoro. Ang total niya ay 42 evacuation centers na.
Okay. Any other information you would like to add, Pam?
Ipakita lang din ulit natin, Sir Cito. Ayan. So far, ayan, may mga tao na tumitingin na din dito. Ayan. Try natin, sir, mag-interview din. Ayan, sir, good morning. Nasa agenda po tayo sa One News. So far, kamusta naman po Yun nga, medyo maaraw na din ngayon.
Oo. Okay lang. Kasi sa amin, yung pumunta na sa ako, Bangkahan. Eh, siyempre, sumilip ako dito.
Kamusta po yung nga pag-ulan, yung pagbaha kagabi?
May lang naman, yung hangin lang. May lang.
Hindi naman po nagbaha sa area nyo?
Hindi naman. Hangin lang malakas.
Meron po ba tayo naging pangamba kagabi? Lalo't po ngayon, 30th anniversary, or 2009 Ondoy Safety.
Oo, nga, no. Wala naman. Di naman nagkamba. Doon sa kabila, sa pamilya ko, sa Peru, doon daw, malakas yung hangin, bumugong sa bahay nila.
Salamat po,
Okay,
sir.
thank you.
Ayan.
Okay,
Tapos
Pam.
dito, Sir Cito, pakita ko lang din saglit. Kasi ito, nung kagabi, medyo super taas nito. Pero ngayon, kung makikita natin dun sa dulo, merong mga nagbabasa ng tubig para din matanggal yung mga putik dito sa kalsada, Sir Cito.
The mud that's on the streets right now, are these wash-offs from higher ground or brought by the Marikina River?
Sir Cito, sorry, medyo nag-choppy lang.
Yung putik, the mud on the streets right now, did that come from the higher ground or was it from the river when the river overflowed?
Mukhang higher ground siya, Sir Cito.
Mm-hmm.
Dahil nga medyo madami din siyang putik na hindi pa din nawawash off. Although, ayan, ngayon meron ng tao. Pero dati, Sir Cito, or kagabi, hindi yan kita dahil nga umabot ng 18 meters kahapon or mga past 12:30 a.m. ay nag-third alarm na yung Marikina River dito.
Okay. Okay, Pam. Last question. What activities are planned for this morning? Are most of the evacuees going to be returning to their homes or wait and see pa rin because of the water level on Marikina River?
Well, according to Marikina Mayor Marcy Teodoro Sorcito, may mga iba na daw na families from evacuation centers na mga bumalik na sa kanilang tirahan. Kagabi din, may mga na-interview tayo, Sir Cito, na bagamat, yun nga, nag-preemptive evacuation sila, pero as soon as umupa daw yung ulan, ay babalik din sila dun sa mga tirahan nila para din maglinis or magtanggal nga nung mga putik or yung mga tubig na pumasok sa kanilang tahanan. And then, Sir Cito, dito naman, malapit sa Marikina River, ay tuloy-tuloy pa din daw yung dredging activities or yung flushing operations para tuloy-tuloy na din yung pagbaba ng level ng Marikina River dito, Sir Cito.
Okay, thank you very much, Pam Vasquez, our mobile journalist and correspondent reporting from Marikina City. Magandang umaga. Please take care of yourself. Okay, that's Pam Vasquez, and that's the live report from Marikina. It's a good thing to note that the water actually subsided much faster than we had expected, because normally, even after the typhoon passes, the waters still rise because of all the rainwater accumulated from the watersheds and the higher ground. Okay, now let's get on with the program. Latest info on Typhoon Karding. From being a super typhoon, Karding has been downgraded to a typhoon as it continues to weaken after going through the Sierra Madre mountain range. Typhoon Karding made its second landfall in the town of Dingalan, Aurora, Sunday evening. It earlier made a landfall in Bordeos town on Polillo Island in Quezon Province. Okay. And typhoon signals have started to be brought down. In large part, they've been removed. And we will continue to update you. There we go. Signal number 2 as of 5 a.m. La Union, Pampanga, Tarlac, rest of Pangasinan, rest of Zambales, southern portion of Benguet, western portion of Nueva Ecija, northern portion of Bataan, And signal number 3 for western section of Pangasinan, Bolinao, Bani, Anda City, Alamino, Sual, etc. Northern and central portions of Zambales. Okay, and signal number 1, as of 5 a.m., Ilocos Sur, Quirino, Nueva Vizcaya, Bulacan, Metro Manila, Rizal, Cavite, rest of Benguet, rest of Nueva Ecija, rest of Bataan, western portion of Ifugao. Okay, now that wraps up the update because the sun is shining here in Barrio Capitolio, Pasig, although I think it is playing wrestling with the clouds. Okay, so let's now go to our usual programming for this day. We have with us two gentlemen who will be talking to us of a public health concern, but also about I think it's a business, but more than that, a conference that I picked up on last week. Let's roll the Betamax, Gab.
Yuri Marshall is the Chief Executive Officer of Mind You, a company aimed at providing mental health services in the Philippines. Prior to this, Marshall shaped a successful entrepreneurial career by leading Visa One, an immigration legal firm in Queensland, Australia. Dr. Miguel Mantaring is the Department of Health's Chief of Program Management and Capacity Development Division. He joined the department in 2020 as a medical officer in the Health Promotions Bureau. He was a municipal health officer in Itbayat, Batanes for 3 years as part of DOH's Doctors to the Barrios program.
Okay, welcome to the program, gentlemen. Good morning.
Good morning.
Good morning.
Okay, Miguel, what's your nickname? Migs or is it Miguel?
Actually, my friends and family call me Migo.
Migo, okay. And Yuri, I believe the correction is in order regarding your family name. It's Marshall, right?
Yes, it is Marshall.
Okay, it's not Marshall Bonifacio. Okay. Anyway, I picked up on that one. But gentlemen, welcome to the program. Yuri, I'll start off with you. There's this thing about mental health, a conference from what I recall, because every time someone says mental health, it kind of sounds the alarm for me because I'm very sensitive to the topic. And could you kindly elaborate on what this upcoming conference is about?
Yeah, sure. So this coming October 24th and 25th is actually the second National Mental Health Summit that we're hosting in partnership with the DOH. So it's a nonprofit event. It's designed to bring stakeholders, policymakers, advocates in the industry so that we can shine a spotlight really on the state of mental health in the Philippines and also be able to share what resources are available, whether it's national or at an LGU level.
Okay, now, you judging from what I see on screen, you're quite young, and I mean, how did you and Migo get into this business of mental health, Yuri?
So I thank my youthful looks from my mother in Mindanao. However, I'm in my fourth decade now.
Seriously?
Really...
I thought you were in your 20s or 30s.
Sana all, I wish. Pero,
okay.
My entry point into mental health really was my personal experience. I've had my challenges in relation to my bout of suicide in the past. And so that's really, it's made me pivot from the legal industry into mental health. And so it's very important for me. I've returned back to the Philippines with the mission of creating infrastructure across the entire spectrum, whether it's through small to medium enterprise, large enterprise, communities, and then now government. We're looking to form and forge more partnerships with government agencies so that we can reach more people.
Okay, you had a suicidal episode in your 30s, is that correct?
Yes, essentially. And so being able to move through
Wh-
that.
What was her name?
I want to be very respectful and not really cite
Yeah,
too many
yeah.
circumstances
No,
around that.
I'm just trying to wake you up this morning because I have no I am not ashamed to admit that I've been down that path and twice. And ladies and gentlemen, at least I think it is important that we are all open, public, and share our pain, our experience with others so others can avoid the near disasters that we faced in life. I've written about it, so that's why I just kind of, with age comes the ability to poke fun at a very dark time in our life. So that's why I asked what was her name. But Migo, what about you? You're a physician, so I would presume that you've not had an issue with mental health, or did you also have episodes of mental health problems that push you towards this territory?
I think Sir Cito, regardless of the gravity of what someone faces, we all have mental health in some way,
Mhm.
especially during this pandemic wherein our lives really changed the way that we normally lived life. We were put in lockdowns. A lot of people lost their jobs, their livelihoods, and everything. So I think in this time where we experience something drastically different, mental health has never been put on the spotlight. And I think that's part of the advocacy that we want to promote together with Mind You in the Department of Health. That it's really okay to not be okay, because the best form of support that we can get is by caring for ourselves and caring for others.
Okay.
So
As a physician, Migo, can you say, or Yuri, in your line of work now, can you say that there are a certain type of individual that is more inclined to have mental health challenges? Because I tend to think that it's the passionate type of individuals who end up pushing themselves to the line. But is there something that's available that tells us now, okay, if you have this profile, there is a likelihood that you're going to have this episode?
well, Sir Cito, based on studies, there is a genetic predisposition to some people developing mental health problems. So there could be family histories, etc. But mostly factors which contribute to having mental health conditions across the globe are largely related to the context, the setting that an individual is in. So that goes to say that there's no really good way to determine if you as a person will experience a mental health condition in the future, but how all of these factors contribute can determine whether you will have a mental health condition or not. So safe to say, everyone can experience a mental health condition, and it's a large part of our own genetics and the environment that we're in.
Okay, so what about in your observation, Yuri? What is the score out there? Are Asians more inclined or less inclined to have mental health issues, or do white people or Westerners have a propensity for mental health?
I think what I'd like to focus on is really the Philippines.
Mhm.
What Doc Miguel was mentioning before in terms of environmental factors. Mind You's actually been servicing large enterprise, small to medium enterprise for over 2 years now.
Okay.
And we can see that mental health is an issue across the entire demographic spectrum. Because I think what I'd like to at least spotlight is that the term mental health is quite a heavy term. And so what comes with it are the stigmas associated with it. But if you just remove the term mental health and look at people's behaviors that are affected by their environmental factors, for example, stress at work, right?
Mhm.
If there's stress that leads to other illnesses such as depression or anxiety, the ability for a worker to actually seek help there's a lot of barriers. It's very difficult. And so there's also mahiya sila. They
Mhm.
also don't want to approach their own HR to tell them that they can't work. And so what Mind You does is we destigmatize and break down those barriers so people can actually seek the talk therapy that they need. And our approach is really preventative. And so it's
Mhm.
really giving people access to talk to somebody before it becomes serious. And so that's the conversation that I want to promote, which is it's okay to not be okay. You should be talking to people, not just around you, but professionals. These are licensed psychologists, licensed psychiatrists. Even I would go as far to say registered guidance counselors if you're in your youth or if you're a younger person, getting access to that in your own schools. There's mechanisms for that the DepEd has. DOH, we're about to embark on a pilot program in 9 different LGUs for the last mile elementary period for students so that they can gain the courage.
Why the special focus on the last mile?
Because that's an age where according to the data from DOH, we've been informed from Mind You's end that's an ideal age for the adoption of the education and the awareness. They're at an age where they can actually start practicing what we're going to be teaching.
Okay, Migo, 3.2 million Filipinos suffering from mental health. I mean, are we talking strictly of clinical psychosis, clinical cases, but doesn't include the type of situations that Yuri was talking about, the professional or personal, the less clinical type of mental health challenges?
Right. Actually, Sir Cito, the numbers that we have, they're exactly that. They're largely based on the reports that we receive coming from our health units and health facilities. So it does paint a skewed picture of how we are only able to track and catch the more apparent forms, the more clinical forms, but the precursors to those, yung mga nagsisimula pa lang, no, yun yung hindi natin nakukuha talaga. So that's a major limitation that we have in terms of really getting a good picture of the mental health situation in the Philippines.
Okay, so we are in effect underreporting mental health challenges that by and large can compromise, if not jeopardize, the stability of companies, of institutions and families at large. Because I mean, I just experienced burnout. And most people will say, well, burnout doesn't really qualify as a mental health issue. It's more fatigue, it's more, etc. Yuri, I see you nodding there. What's your impression regarding that? Because you used the word stress, and that seems to be the the end all and be all for professional mental health issues.
Well, there are varying degrees of stress. And so, the layman, the average person that does not know all these terms, right? How do they associate their personal stress with the ability to self-recognize that they need help, right? Especially when people around them are saying, it's okay, you should just brush it off. It's part of work. Kaya mo yan. Don't be weak, especially when there's those intergenerational stigmas that also exist between the older generations that essentially show some form of judgment and stigma creation when it comes to millennials and Gen Zs. And that's translated now into other activities that's now has a spotlight, such as quiet quitting, the Great Resignation, etc. So these are things that cannot be ignored, and being able to scale the language back down to just your average layman is necessary. So in our practice, we really use words that are very simple to move people into action, and also to measure whether they're in a state of anxiety or depression or stress, high levels of stress.
Okay, you mentioned earlier that you pivoted from the legal profession to mental health. Now, how does one do that? Because I think your first challenge would be you can't talk about mental health if you're not a psychiatrist or you're not whatever.
I'm a patient. I can speak of it from the point of view from a person, and I'll admit to this. I was really against using professional therapy before my bout, because I was a son of a very strong Filipino mother that didn't believe any of that. You know, when my first father passed away when I was in primary school, we never sought out any assistance because, you know, from her perspective, we just had to toughen up. And so that pivot of mine was really just an acknowledgement that there are other people in my situation, whether they're facing that choice of whether to live or whether to not live. And so it's a mission of Mind You, and now obviously with DOH, to reduce the rate of suicide around the country by providing a level of education awareness that can be adopted by the communities and can be adopted by individuals. And so that's our goal, is to really understand how to deliver this content, this education in various languages, through various mediums, even through the subcultures, right? So you look at Mindanao, they got very strong stigmas there. So that's one of my main areas that I'd love to do work in.
Okay, but Migo, how bad is the situation? Because you know, we can't. Yuri is right. You know, Filipinos will tell you, pwede ba? Huwag kang maarte masyado, etc. You know, but how bad is the situation?
Yeah, actually, Sir Cito, because of that attitude, it contributes to the problem of not having an accurate picture of the mental health problems here in the country, because people feel that they don't need to report it, they don't need to see a professional, so that we don't really get the actual numbers. But what we can tell, since the pandemic started with the National Center of Mental Health's crisis hotline, the calls have really been increasing, more than 20,000 calls in a year since last year, and it has been doubling since the pandemic has been going on. Right now, we already have established local hotlines in all regions, so it's really busy for all of these service providers to be tackling suicide-related calls and queries. So we can see from there, based alone on that fact, that the demand is there. So many people need professional help from our crisis hotlines, and that's really something that Mind You is also supporting, because the government can't do it alone.
Okay,
So, yeah.
let's go for a quick break, gentlemen, and when we come back, let's lay out what Mind You is all about. How do you guys help out? How do you engage the public, clients, etc.? We'll be right back here on Agenda. Okay, welcome back to the program agenda, and we will pick up where we left regarding this mental health conference that's supposed to go on, National Mental Health Summit. Okay, Yuri and Miguel, welcome back to the program. Now, let me ask, Yuri, for starters, how did Mind You as a company come about?
The catalyst for Mind You was the act that Senator Hontiveros passed. And when I returned back to the Philippines at the time after my bout, I was actually presented by a small group of individuals, the statistics surrounding mental health. And because I had just recovered, I had joined the group, and we decided that we were going to put together an organization that would have a 100-year mission and vision in order to transform mental health in the Philippines once and for all, in terms of building infrastructure across the various layers of society.
Okay, and how exactly does this thing operate? Miguel, what's your participation in Mind You? Are you representing the DOH or are you part of Mind You?
No, I'm currently in the Department of Health. So our bureau, the Health Promotion Bureau, is partnering with Mind You as the organization to sponsor and host this mental health summit in October.
Okay, now, what does Mind You do, Yuri? This will be the second summit that you're hosting on mental health. Now, how do you guys operate? How do you go about doing what your business model?
Sure. So initially, we decided to service working communities because we understood that cost was a barrier for most individuals to get access to talk therapy. So what we wanted to do is we wanted to convince business owners to cover their working staff. And so that's what we do. We cover at the moment small to medium enterprise working communities, and then large enterprise working communities. But I'm actually very proud to say that towards the end of the year, we're going to be actually expanding our reach just to the general public. And we've been able to do that with the assistance of the Australian government. They've assisted us with building an app which can be leveraged, and anyone can actually access talk therapy, affordable talk therapy across the country.
Mm-hmm. Okay, so it's essentially like a hotline.
So there is also a hotline that we're actually building an infrastructure, and that's also underway because that was the mechanism that actually saved my life, a hotline. Mm-hmm. And so being able to expand the resources and infrastructure here in the Philippines is actually necessary if we're going to be, wanting to put ourselves in a position to save more lives.
Yeah, okay. The good intention is there. And okay, you're able to get grants from the Australian embassy, Australian government, and perhaps from some private corporation. But where does the money come from to run an organization like Mind You? Because it is a business, right?
It is indeed. So our client companies, when they subscribe to Mind You services, they're essentially covering their entire staff. So they're paying for all of their staff to receive unlimited talk therapy.
Okay, and do you go in and do an assessment? Do you do interviews, clinical assessment of staff, etc.? How do you determine the need of a small business or a big corporation?
So essentially, we do roll out assessments and surveys. We have a diagnostic approach at Mind You. So we're not your typical vendor where we just provide webinars or training. It's an ecosystem approach. So when we go in, there's a plethora of services that end up becoming part of the response once we pick up data in our organization. So for example, if we look at a large organization with 5,000 staff, we actually send out assessments and surveys, and then we pick up data through the talk therapy sessions and any other engagements with us.
Okay. Now, Amigo, what convinced the Department of Health that this is a good partnership? Because you're doing round 2 of the conferences, and I know that the DOH, you're very proactive. In fact, I'm going to be hosting the conference on generic medicines on Wednesday. So between that and the mental health conference, that's already two for the remaining quarter of the year. So you guys are very active, but you don't readily partner with private organizations unless you have a reason or there's track record there. What motivates the DOH to partner with Mind You?
Actually, in contrary, Sir Cito, we do engage in a lot of partnerships because since the Universal Healthcare Law was enacted in 2019, to achieve the best health of all Filipinos, the strategy in the health sector was really to put more weight on how we can prevent and promote good health so that Filipinos do not get sick in the first place and they don't experience the financial hardships when having to pay for very expensive medical services and medicine. So with the enactment of the Universal Healthcare Law, our bureau, the Health Promotion Bureau, was transformed and created. So it is our mission to really promote healthy behaviors, not only by increasing literacy, not only by educating people what they should know to live a healthy life, but also working with how we can modify our environment so that the healthier behavior will be the easier choice for every Filipino every time and everywhere, regardless of where they are. If they're near a health facility, if they have money to pay for it, it's easier for everyone and no one is left behind. So in this mission that we have in the Health Promotion Bureau, it's something that we in the health sector cannot do alone. DOH cannot do alone. So that's why it's part of our agenda to steer many people, many stakeholders, private, public, into that vision of the best health for all Filipinos. So we really try to expand the networks that we have because it just multiplies the messages that we want to deliver to every Filipino in the country.
Okay, but does the Health Promotion Bureau get sufficient support and recognition? Because I, for one, agree with you, and I see the importance and the value of the Health Promotion Bureau because, you know, it goes back to the adage, you know, how does it go again, Yuri? Was it a spoon of prevention? An ounce of prevention is better than a pound of cure. But does the Bureau for Health Promotion get enough funds to do what they should be doing?
Yes, so as mandated by the Universal Healthcare Law, the health promotion funds within the Department of Health should be equivalent to at least 1% of the department's budget. So since our establishment as a bureau, we have steadily been achieving this goal of having this financial resources allocated to us coming from the funds of the government of the Philippines. So yes, we do have sufficient resources, but in terms of our reach, it's really critical for us to be entering into partnerships like this with Mind You so that our mission can reach more people.
Okay, what happened in the first conference so much so that it convinced the DOH to play it again, Sam?
Well, actually,
yeah. Go ahead, Yuri. Go.
I was going to say actually. So the DOH was involved in the first National Mental Health Summit as a speaker. So we invited stakeholders even in the first one. Because what we wanted to do was ensure that whoever was watching was aware that even these national government agencies had resources, they had hotlines, they had programs. And so whether a lot of people get access to that or have the awareness of that, that's another question. And so that's one of the areas too, where Mind You really wants to support the government, because for all of these resources that are available around the country, you're going to need private partners to really push the agenda. And that partnership across the whole social spectrum is going to be the catalyst for change. And I think that's going to be, you know, the recipe for success is that cooperation amongst the private and public sector.
Okay, now you mentioned that the primary program is having an app or the equivalent of a hotline for participants and those who download to have access to a talk therapy, unlimited talk therapy for those who believe they're suffering from mental health. Now, are there anything in the works beyond that? Because I don't know, Migo, if you will agree with me. I am still trying to find the best nutrition expert in the country, because part of the problem we have in the Philippines, particularly in call centers, offices, and among students, is I have to watch my language here, but really crappy food that they take while they're doing their job. It's all sugar, sugar overdose, etc., which sends them on a spike and then on a downward spiral. And next thing you know, they're messed up mentally. Their physiology, their chemistry is so off that it affects their brain. Now, Yuri, Migo, any plans to work on that particular concern?
Well, maybe to start off, in the Health Promotion Bureau, we don't just focus on mental health. To achieve a healthy life, we believe that we need to be addressing several behavioral risk factors to comprehensively contribute to achieving that healthy life wherein we don't get sick. Mm-hmm. So beyond mental health, what we promote in the Department of Health is also physical activity and healthy diets, environmental health, immunization, substance abuse, sexual and reproductive health, and violence and injury prevention. So all of these risk factors in conglomeration, when we promote it, it contributes to each other. It's all interlinked. You can't talk about mental health if you're not talking about sexual and reproductive health. Like what you mentioned, diet and physical activity also contributes to mental health and other health outcomes. So when we package this of having that healthy lifestyle, and that's what we need to be achieving, that's how we can hit these other factors which come into play to influencing poor mental health among Filipinos.
Okay, the National Mental Health Summit 2022 is set on October 25 to 26 at the Samsung Hall SM Aura Premiere. Now, Yuri, who are going to be the guests or presenters at the event? Because who you invite essentially lays out what your programs and directions are going towards.
I'd love to make a official announcement. However, we're going to be making that full announcement of all of the speakers and hosts and panel discussion panelists within the next couple of days. So I'd like to say that just stay tuned to our social media and even the DOH's social media. We'll be making those announcements shortly. I want to leave it for a surprise for the public, but we're going to be having stakeholders across the entire industry, which even goes towards nutrition. So this year's Mental Health Summit is going to be looking through mental health through various lenses, such as food and nutrition, financial stress, physical movement, mind, body, and spirit. And so even art therapy, that's another modality in which people use as part of the healing process. And so all of those different areas is basically testament to the biopsychosocial model that we adhere to. And so we're very excited for people to discover that through an experiential summit.
Okay, experiential summit. That's going to be interesting. Now, just so our audience are aware, I have been devoting a lot of time on research and viewing podcasts and documentaries, and one of my more recent discoveries is the accidental discovery of how specific or particular diets have accidentally improved mental health conditions in patients in the United States and in Europe, particularly those who are suffering from schizophrenia, autism, and ADHD. Apparently, there were patients who went to functional medicine practitioners, dietitians. These patients were placed on a particular diet, and while the patient was losing weight or improving the metabolic process of their bodies, observed that certain neuroses, certain mental health conditions had greatly improved. So I'm just putting it out there because you guys are going to be hosting the event. And, I think at this stage, we can't just dope up our patients, our friends or relatives. There has to be some other solution, and we're putting it there. Anyway, going back to this mental health thing, what about the DOH? What about on your side of the fence, Migo? What participation will the DOH have for this mental health summit?
So definitely we'll be supporting all of the activities and all of the agenda set within this National Mental Health Summit. It's a co-branded summit between the Department of Health and Mind You. So we're working in close collaboration with Yuri and the rest of the team to really tackle the main issues that we see at a government perspective also.
Okay, now Yuri, you can't tell me your guest list because you're worried I might pirate them and invite them to agenda and preempt your summit. I won't do that to you.
You're very welcome to join.
But okay, how is the reception for events such as this? Because as Amigo pointed out earlier, there's still a stigma. There's still, a apprehension, and you yourself are nodding your head, confirming that. But how has the reception been on the first summit? And right now, has there been a sizable interest or commitment to join the summit?
Yes, this year's focus really is to be able to widen and broaden the reach to the mass population. So this is general public. We didn't want to have a summit that's just siloed amongst professionals and stakeholders. We wanted everyday people to actually get excited about some solutions that they've never ever explored. They can solve their mental health, their preventative mental health from a food standpoint, from a breathing standpoint, from an exercising standpoint. So I think that we need to be able to reach more people as a society by leveraging off advocates. And so for all of the celebrities, for example, that have really donated their time in kind, I just want to have a huge shout out to all of them. Thank you so much, because we didn't really have to go out and convince anyone. We just had to shine a spotlight on the crisis, the state of the nation in relation to mental health. And a lot of people are struggling, and they have struggled in the past and still going through it. And so this has been such a summit that's, I'm very proud to say, a lot of people have just come together. Even the space itself was donated, right? So everyone that's coming is donating their time, their energy, and their passion towards something that they recognize is an issue and is a challenge. And so I'm actually very much looking forward to October, where we all come together, have the conversation, and then carry it forward to those people that at the moment may not have the courage to talk about it yet. So ayun, that's the reason this year we've really taken more of a more exciting stance rather than a very professional, strict, this is only for people that are educated stance. We didn't really want to do that. We wanted to make it accessible and digestible and somewhat joyful, and even looking at through the spectrum of the darker energies, people that are struggling. This is another shout out to everyone out there that's struggling. This is the right place to come to, and you can learn about mental health in a way that matters to your daily life struggles.
Okay, Migo, Yuri, I have 3 friends, very rich, influential families. And what they have in common is a son who basically committed suicide. And when that happens, we kind of say, what a loss, feel bad for the parents, and that's so sad. and we kind of just move on and forget that they're still walking wounded. The parents who, or the family or friends who, I know I had a student at one point whose friend had, I think, done the same thing, and she was affected. She wasn't even family, but she was the best friend, and she was carrying that burden for years until I managed to have a word with her, sit her down, and make her understand that it was not the right way to celebrate the memory of her friend. Now, what is there anything in that conference or right now in the mental health program of the DOH for the families, for those who are continually grieving an unexplainable tragedy?
On the DOH's side, that is a large challenge that we acknowledge and recognize. I think the large part of the work that we're doing in relation to mental health is moving this beyond professional and clinical care. That making every Filipino understand that we have a role to play in promoting our mental health by supporting others and ourselves. So what we do and focus on right now is really increasing the self-care skills and how we can show support to others, because that's the foundation. That's what we interact with every day. So we have to understand that our problems can't be kept inside ourselves alone, and we do not necessarily have to seek professional help on the get-go, but how we as people, as brothers, as sons, as significant others, how we can support people who experience these kinds of problems. And that's part of the work that we want to promote and do, creating informal community group structures wherein they're all talking about mental health, formalizing peer support groups. So that's increasing the more foundational services, the more first-hand, first-line encounters that people will have in their communities in terms to addressing mental health conditions, on top of the clinical services that professionals provide.
Okay, thank you, Doc Migo. Now, Yuri, last 1 minute to invite our audience to the National Mental Health Summit 2022 on October 25-26 at the Samsung Hall SM Aura premiere.
Yes, thank you, Cito. It's an open invitation to the general public. You can attend via live stream if you're not in the Metro Manila area. And if you are in the Metro Manila area and you want to register, you can do so as well. It's a shout out to everyone from every walk of life, regardless where you come from, what your demographic situation is. Please make the effort to come to this year's National Mental Health Summit. We'll even be talking about stories of hope, people that have lost loved ones, people that have had tried to take their own life. Hearing stories of that will allow you to move through your grief and even unearth some of the unresolved conversations, emotions, and burdens that you potentially may still be carrying today. And whether it's for yourself or for a close family member, this is the right space where you can explore how to go through a healing process that is right for you. Every journey is different. And so that's my invitation.
Thank you very much, Yuri Marshall and Miguel Mantaring, for joining us this morning.
Thank you very much.
Okay, and allow me to just say, ladies and gentlemen, for those of you who have gone through the pain of such conditions, and I quote the comedian Michael Jr., he said he's an Afro-American comedian and Christian advocate. He said, your pain can be your gift to others. If you keep it to yourself, it remains a pain. But if you share it with others, as well as the learning, you can turn it into a gift that can protect others or heal others. Let's now go to our blessing for the week, and we go. May those who perpetually pour receive. May those who constantly carry discover what it feels like to be supported. May those hidden behind walls of silence find safe places to speak. May those who fight for others encounter those who will fight for you. And that is from a person named Dr. Thima. I am Cito Beltran, thanking you for joining us today, Monday, first day of the week. I do hope that you did not suffer personal loss or much tragedy from Typhoon Karding, and whatever the challenges are, keep your faith and get on with life. Thank you. Please keep it here on One News PH.